With the continuity of the third video of anti-diabetic pharmacology, I started my main topic, that is insulin preparation. So what are the insulins and how many type of insulins are present? There are the rapid acting with very fast onset and the shorter duration of action, short acting with rapid onset of action, intermediate acting, that is NPH, which is the most commonly used, long acting with slower action, that is a glargine, and the determined, and it have the individualized therapy. Different patients have different therapies, and each patient give therapy or regimen according to their individualized condition. Some insulin preparation available in the USA. These are the insulin preparation. Some of these are also present in the Pakistan, like the Novo Nordics and Novolin, NPS 7030, Himalayan, long-acting insulin, determined, and etc. Rapid acting and short acting insulin preparation, modification of the amino acid sequences of the regular insulin produce analog that are the rapid acting, like the insulin Lispro. Lysine and proline at the position 28 and 29 in the B chain are reverse. Peak level 30 to 90 minutes because it is a rapid acting. We give 30 minutes before the meal as compared to the 50 to 120 minutes for the regular insulin. And you can notice with a little modification from the regular insulin, we will form the rapid and short acting insulin. It also alters their duration of action. Wow! It's mimic the prandial mealtime release of the insulin and to control the postprandial glucose. Link this point with the clinical condition, that in which type of the diabetes you will prescribe the insulin. Administer in the 15 minutes preceding a meal or within the 15 to 20 minutes after starting a meal. Then intermediate acting is the NPH. Addition of the zinc and the protamine to the regular insulin. If you are my regular student, you should click the point from where we learn this word protamine. Then insulin isophane, less soluble, resulting in delay absorption and a longer duration of action. Longer acting insulin, lower isoelectric point leading to the formation of a precipitate at the site of the injection, that is called the phlebitis. Lower isoelectric point, slower onset and a flat prolonged hypoglycemic effect because it is a lower acting, so it want to stay in the body for the longer acting of the time, and how much time it stay in the body it will produce its effects. Insulin determined had a fatty acid side chain that enhance the association to the albumin, that's why it will attach with the albumin, so it is a longer acting. Then pharmacokinetics and the fate human insulin is produced by the recombinant DNA technology. Obviously, modification of the amino acid sequence of human insulin produce insulin with the different pharmacokinetic properties. Insulin preparation vary primarily in their onset and the duration of the activity, dose, injection site, blood supply, temperature, and the physical activity can also affect the insulin preparation. Because insulin is a polypeptide that is a proteinic in nature, generally administered by the subcutaneous injection, continuous subcutaneous insulin infusion, that is called the insulin pump, which is used earlier, not commonly nowadays, is another method of the insulin delivery. Nowadays you can just inject the insulin sub-Q within a millisecond, and that's all. Adverse effect of insulin: hypoglycemia, obviously it will decrease the glucose, weight gain, local injection site reaction because you can daily inject the insulin at the same place, or at the same site. Lipodystrophy diabetes with the renal insufficiency may require a decrease in insulin dose. Why? I think you people can link it from its excretion. You are sufficiently efficient to link this. And that's all from today. Inshallah, you can see our next topic, that are the oral anti-diabetic. So inshallah, from the next video we will start from the oral anti-diabetic. Till that, take care. Allah Hafiz.